Hello, dear. My name is Rosemary Anaje. I'm a family nurse practitioner and a graduate student at Bradman University. Today, I'll be presenting my innovative video proposal. Here's an overview. Statement of problem the innovation will solve. Background of the problem. Innovative collaborations. Utilization of appropriate technology and mobile app. Innovative solutions. What problem will the innovation project solve? This innovation project will solve the problem of obesity among African Americans. According to Kumayiko and Co., obesity is more prevalent in America compared to other developed countries. Among African Americans, the burden is disproportionately high compared to white populations. It is of concern because of the comorbidities such as diabetes, cardiovascular disease, hypertension, stroke, to name a few. Therefore, reducing the burden of obesity among African Americans can help them lead healthier lives and prevent the development of obesity-related complications. What is known about this problem? Obesity constitutes a significant public health threat. According to Center for Disease Control and Prevention, the prevalence of obesity among African Americans is estimated to be 46.8% compared to the 12.7% in non-Hispanic Asians and 37.9% in non-Hispanic white. Also, according to CDC, in terms of gender, 54.8% of African American women have obesity compared to the 38% Caucasians and 14.8% Asians. As the obesity crisis escalates, associated healthcare cost increases. According to Trammell and Co. in 2017, the U.S. spends an estimated $2 trillion, 2.8% of the gross domestic product in obesity-related health services. Obesity leads to increased morbidity and mortality and causes loss of and lowered productivity, thereby delaying economic growth. Among obese people, losing weight and staying healthy is of critical importance. Increased physical activity and healthy diets have been identified as crucial in obesity management. However, Kumayiko in 2014 established that weight loss programs are not effective among Black populations compared to whites. One of the primary barriers identified is the lack of integrating individual, programmatic, and environmental influences in the weight loss initiatives. Factors such as individual motivations, attitudes, and preferences impact weight loss. In recent years, mobile information systems, in particular applications, have received global attention due to their personalized and convenient approach to weight management. Developers are incorporating obesity-specific care into apps so that people with the condition can keep track of their weight, exercise, and diet in real time. Because burning calories is critical in obese people, developing apps that can help a person evaluate the effectiveness of their exercise program can be of substantial benefit. With whom did I collaborate when working on my proposal? Collaborations in practice are essential for the development of novel ideas, views, and perspectives. For this project, I collaborated with 3 family nurse practitioners. The first is a clinical nurse educator who is also a certified diabetic educator. She provided evidence-based knowledge pertaining to obesity management. The second is a family nurse practitioner who has years of experience as a certified diabetic educator working in a weight loss clinic. She availed with information on resources needed to support the innovation project so that obesity-related complications can be averted. And lastly, is a family nurse practitioner with experience in a United Neighborhood Clinic, which is a low-income clinic, where she sees predominantly low-income patients from all race and descents, including African Americans. She provided information on what constitutes an effective and impactful app. I learned an ideal mobile app should perform specific tasks by be user-friendly and compatible with multiple devices and platforms. In accordance with their advice, I chose an app which can be used in any smartphone with an Android operating system. The app has high user engagement, easy to use, and it incorporates features needed by obese people for their weight loss and holistic lifestyle plans. What mobile app did I propose to use to solve the problem? The mobile application chosen for this innovation project is the Spark People. The application is designed to help obese people keep track of their exercise and fitness activities. For obese people, burning calories and adhering to holistic lifestyle approaches is critical. Therefore, Spark People will be of impact in the walk-in program as it helps the obese people visualize the effectiveness of the weight loss intervention. Additionally, the app users have access to information pertaining to healthy diets and recipes, in particular, the number of calories contained in their diets. Why is my proposed solution innovative? The proposed solution is the use of mobile application to help obese people manage their weight loss. The proposed solution encompasses traditional method of losing weight such as physical activity and dieting and mobile information technologies. According to Zayden & Co. in 2016, mobile technologies offer a more productive weight loss strategy. The apps are individualized, portable, and can collect data in real time, allowing the obese person to visualize the effectiveness of the weight loss initiatives in real time. The app chosen also allows its users to share their experiences, thereby motivating each other to continue staying healthy. Here are some of my references, and these are a continuation of my references. The end. Thank you for watching my innovative video proposal presentation.